Congestive heart failure. Prevention, diagnosis, and treatment. Did you know that more than 5 million people in the United States have congestive heart failure, and that the condition is the most common diagnosis in hospitalized patients over age 65? Check out our primer about a metabolic condition in which the heart doesn't pump blood as efficiently as it should. In other words, the heart muscle has become less able to contract over time or has a mechanical problem that limits its ability to fill with blood. Don't forget to always talk to your doctor or any healthcare specialist if you feel something's not right with your heart or any other organ in your body. Welcome back, folks, to another edition of Sweetie Q. Today we want to give you a quick primer about congestive heart failure, the prevention, diagnosis, and treatment. Now, when it comes to prevention, the best way to avoid congestive heart failure is to avoid the conditions that contribute to it in the first place, right? Or to carefully manage this condition if they develop according to research. So things like smoking, you want to stop it, right? Don't even start smoking, because smoking is a major factor in the arterial damage that can cause heart failure. Also, you want to steer clear of secondhand smoke. Passive smoking could also be a corollary to the congestive heart failure. You want to eat in heart healthy ways. You want to think about your heart when building a diet, when forming a diet. The foods that help you are those that contain little saturated fat, trans fat, sugar, or sodium, right? So you want to think about veggies and fruits, low fat dairy, lean proteins such as chicken without the skin, and good fats such as those found in olive oil and avocados. Now, you want to get practical ideas about how to eat heart healthy. You can contact your doctor. Again, go back to your healthcare specialist for that, or your nutritionist. Lose pounds if you are overweight. Now, along with diet, being physically active helps achieve this goal and is very also wonderful for your heart, according to research. Again, even the CDC, the Centers for Disease Control and Prevention, has said that losing weight is a great mitigant when it comes to congestive heart failure. Now, if you have another type of heart disease or related condition, you want to follow your treatment program, of course, under the supervision of your healthcare specialist, right? Because ongoing care and adherence to prescribed medications such as statin drugs to treat high cholesterol can make a big difference. So that's for the prevention. Let's talk now about diagnosis. Now, as of today, there is no one test to diagnose heart failure, unfortunately, but your doctor will consider your medical history, right? Family history, sometimes a physical exam, and the results of various tests. Now, those tests can include the electrocardiogram, what is usually called EKG, right? So this is usually a painless test that gives information about your heart's electrical activity, including how fast it beats and whether you have had previous heart attacks. The doctor can also do a chest X-ray. This gives the doctor a picture of your heart, lungs, and other chest structures that reveals whether the heart is enlarged or there are signs of lung damage. There's something called the BNP blood test, right? This is the B-type natriuretic peptide, BNP, B-type natriuretic peptide. This is essentially a hormone that is a marker of severity and prognosis of heart failure. So doctors kind of look at that, and they look for those BNP markers in the blood. You also have the echocardiogram. This is an ultrasound image of the heart. Now, this is actually different from another test, the Doppler ultrasound, which gives a picture of blood flow to the heart and lungs. Another test that doctors across the country have been very adamant at doing when they have a patient that might face congestive heart failure is the Holter monitor. So Holter spells Holter. So this monitor is in essence a measurement of your heart's electrical activity taken by a portable device that you wear for a day or two. The last test that your doctor might have you undergo is exercise stress test. So you basically walk on a treadmill or you ride a stationary bike to see how your heart performs when it has to work hard. If you are not able to take an exercise test, stress can be induced by administering a drug that causes a similar reaction. The bottom line here is that the physician wants to see how your heart performs under stress. All right. So that's it for prevention and diagnosis. Let's move on now to treatment. After this, I'll be right back right after this commercial break. Welcome back, folks, to another edition of Sweetie Kiwi. We're having a conversation today about congestive heart failure. We're giving you a primer of this condition. We are talking about prevention, diagnosis, and treatment. If you love the content so far, we cover health issues. I mean, obviously, the Sweetie Kiwi show is an infotainment program, so we cover a wide variety of topics, including health and fitness. And if you love the content clarity and quality so far, please consider subscribing to our channel, turn on the notification bell, and we will be very happy to push onto you great content every single day, rain or shine. Treatment. Now, there is no cure, unfortunately, for heart failure. Treatment aims to relieve symptoms and slow the further damage, right? So the plan that you have depends on the stage and type of heart failure, the underlying conditions, and the individual patient. So among the components of a treatment plan, you need to have lifestyle changes. Doctors will prescribe a lifestyle changes. So these are the same type of changes as those for preventing heart failure, right? We talked about them before: not smoking, eating right, exercising. In addition, the patient may be advised to avoid salt because, as we know, salt triggers fluid retention, and caffeine because of heartbeat irregularities. So the doctor will advise how much fluid and what kinds of fluid to drink, as sometimes fluid intake should be limited. Now, when it comes to medications, the type of medications typically prescribed in treating congestive heart failure include the vasodilator. Those expand blood vessels, they ease blood flow, and they reduce blood pressure. You have the diuretics, those correct fluid retention. You have something called aldosterone inhibitors. Those help with fluid retention and improve chances of living longer. You have the ACE inhibitors, or ARB drugs. They improve the heart functions and life expectancy. You have digitalis glycosides, which strengthen the heart's contractions. You have the anticoagulants and antiplatelets, such as aspirin. They help prevent blood clots. You have the beta blockers. Those improve heart functions and chances of living longer. And the tranquilizers, as the name implies, reduce anxiety. So that's for medication. So when it comes to treatment, you have actually 4 categories of treatments. You have the lifestyle changes, the medications, the surgical procedures, and other treatments. So we've already talked about the lifestyle changes and the medications. Now let's talk about the surgical procedures. Now, in more severe cases, unfortunately, surgery may be required to open or bypass blocked arteries or to replace heart valves. Now, some congestive heart failure patients are candidates for a type of pacemaker called biventricular pacing therapy, and that BPT helps both sides of the heart working in tandem, or an implantable cardioverter defibrillator, and this shocks the heart into converting a potentially fatal fast rhythm to a normal one. So ventricular assist devices, VAD therapy, may be used as a bridge to heart transplantation or as a treatment in lieu of transplant. Remember that a heart transplant is always considered the last resort because the success rate are about 80 to 88% after 1 year and 75% after 5 years, according to research. Now, there are other treatments available to when it comes to congestive heart failure, because sleep apnea. This is a condition in which the muscles that allow air into the lungs briefly collapse is linked to heart failure. You may be evaluated and treated for it. All right, I'll be right back right after this. Don't go anywhere. Welcome back, folks, to another edition of Sweetie Kiwi. I hope you are doing fantastic. We are continuing our conversation. Again, a little primer around congestive heart failure. Obviously, folks, we're not giving any advice, any medical advice here. If you believe that there's something wrong with you, please contact your physician, and he or she will know better how to treat you. Everybody's different. This conversation today is about a general overview of the condition. And I just wanted to emphasize that. So, living with this heart condition. Now, here are some of the things you want to do, in addition to sticking to the lifestyle changes that can improve the health of a damaged heart. Monitor your symptoms. Here, obviously, we're speaking to people who might be living with this heart condition. Monitor your symptoms. Heart failures worsen over time. So, you generally need to be familiar with changes in your body. Some of those changes can be addressed with different medications. You want to weigh yourself daily. This is one of the easiest ways to track fluid retention. And this is really, if you have fluid retention, which is indicated by a sudden gain. Swelling in the legs and feet can also mean more fluid is accumulating. You want to monitor your health. You want to keep track of blood pressure, weight, and other vital signs as your doctor advises. You want to get lab work done as recommended, as it gives key clues to your heart health and medication needs. A flu shot and pneumonia vaccine can help you avoid infections that will be especially hard on your compromised lungs. Another thing that's very important, and of course this is not about medications here, but you want to try to keep a positive attitude. Mindset is very important. Congestive heart failure is already a serious condition, but with the right help, you can still lead a long and productive life. Now, remember though, that anxiety and depression, which can cause you to feel stressed, are common side effects. So you want to try and find outlets for your stress. This could be a support group. It could be a therapist. It could be you doing what you always love doing, relaxing hobbies, hanging out with family and friends. Whatever you need to do, just do it. Another thing you want to talk about here when it comes to living with congestive heart failure or the risk of heart failure is never be shy about asking questions. Depending upon the stage of the disease, your doctor will have different recommendations about how active you should be, including sex, exercise, and work. All right, folks, this is really a sort of the primer about today's conversation around congestive heart failure. Let me quickly give you a recap here. We talked about prevention, diagnosis, treatment, and also talk about how to live, quote unquote, how to live with this heart condition. All right, I will see you next time. But before I leave you, let me give you some quick research here. We have research out of Johns Hopkins University, which in terms of congestive heart failure is one of the leading institutions in America here. They've been at the forefront of the study of congestive heart failure, and among their recent findings, they have seen that some groups within the population, including African Americans, are at increased risk of congestive heart failure. This is due to diabetes and high blood pressure rather than race alone. I would say, ethnic background alone. In a study involving nearly 7,000 men and women, Johns Hopkins researchers were able to discover the underlying reason that African Americans are known to develop heart disease more than any other race. When diabetes and high blood pressure are factored out, they face no higher risk. Another thing that came from the research from Johns Hopkins researchers is that a simple blood test can determine which patients will fare better after hospital discharge. So the researchers realized that congestive heart failure patients with a certain level of protein linked to heart stress were 57% more likely to be readmitted to the hospital. Just want to give you a little bit of background research about the topic of congestive heart failure. All right. Thank you so much for listening to this conversation today. I really appreciate it. I will see you next time. But until then, remember, stay marvelous.